Historic meeting of the Commission on Public Health. Historic, why? Because we are near the end of a marathon. And that marathon began technically over 2 years ago with the passing of legislation and has continued to this culminating point. As we'll be discussing, it's not the end of the commission, it's the end of this chapter of the commission's work. And I want to reiterate time and time again, we have done incredible things, not only as a commission, but also as groups of people who are passionate about public health. And herein I include the working groups, their specific leads, the community, the experts. I talk about this concept, right, of the community coming together to serve the community. And in essence, that is what we have seen. So it is my pleasure here to call to order this meeting of the Commission on Public Health as established by legislature and the Governor of Maryland. Today is September 25th, 2025, and the time now is 2:15 p.m. My name is Boris Lushniak. Today I serve as the presiding chair. I'm joined by my co-chairs, Dr. Oluwatosin Olatehu and Dr. Meenakshi Brewster, also known as Tosin and Mina. I go by Boris. We put in all these fancy things, but you know, we are part of the community. I want to remind you, and at this historic occasion, to remind you how all this started. The Maryland Commission on Public Health was established in 2023 to study and make recommendations to improve Maryland's public health system. The 16-member body is comprised of local health officers, academic partners, thought leaders, and legislators. The Maryland Department of Health is represented by the Deputy Secretary for Public Health Services, the Deputy Secretary for Behavioral Health, and the Director of the Office of Minority Health and Health Disparities. Many additional leaders and professionals are contributing to the Commission's 5 work groups, and these work groups explored 5 key subjects relevant to the mission. They included funding, governance and organizational capabilities, workforce, data and information technology, and communications and public engagements. The Commission's goal is to ensure the public health system is designed to help all Marylanders achieve their best health and a lifetime of wellness. Meetings were held monthly and streamed online. And for more information to our listening audience in particular, please visit health.maryland.gov/COPH. This is a public meeting. We have followed the requirements of posting a notification of this meeting. The meeting is being video recorded. By your continued participation in this meeting, you consent to this video recording. We ask that members of the public who may be attending to mute their microphones, especially obviously if you're online. For others in the room, the microphone system will work under a sort of brand new system. So if you as a commissioner are wanting to speak, you press the button in front of you, it will light up a light. I will then acknowledge you. After the acknowledgement, then we will have your microphone connected and you can proceed. The meeting does not include a time period for public comments and will not be monitoring the chat function during the meeting, but we encourage public comments to be sent via email to md.coph, Maryland Commission on Public Health, md.coph@maryland.gov. And so we also just remind you that members of the commission are subject to Maryland public ethics laws. All have confirmed their agreement to this in their applications for this commission and listed any conflicts of interest. There's also attendance requirements that I won't go through, but we've had more than stellar attendance throughout the functioning of this commission. I will now ask, actually, before we do our roll call, we do have a special guest here. We have Dr. Meg Sullivan, who's the new Maryland Department of Health, the Deputy Secretary of Public Health Services here. We welcome you in your new position and ask you to share some wise words with us.
Thank you so much. I didn't come prepared with wise words, but first we'll just say how excited I am to be in this role. I've now been serving for about 5 weeks, and it is just incredible the amount of work that is happening. But very early on, maybe even day one, I know that this commission and the impending report was put on my radar, and something that I'm very much looking forward to. As we said, this is not the end. This is just the beginning of the work and very much being engaged in. I'm here today just as a guest. I just want to recognize Dr. Elizabeth Crom, who was serving previously as the acting deputy secretary and is still here as the Maryland Department of Health designee, and I know has been intimately involved in the work along with my other MDH colleagues, but just really looking forward to the discussion today and the continued work.
Great, thank you for being here, and welcome again to this important role within our state. The agenda for today's meeting had been posted, distributed to the commissioners. Are there any comments on the agenda as posted? If there are none, I do ask from one of the, yes, Shane? Roll call. Oh, roll call first, sorry. So let's do roll call first just to make sure that all this voting in fact does take place. I was just testing Shane because Shane is already, many of us are already in concluding, kind of time mindset, right? It's almost over and all that. Good pickup, Shane, so I know you're paying attention and will keep us in line. So let's have the roll call of the commissioners. Shane, take it away.
Delegate Bagnall.
Here.
Camille Blake Fall.
Present.
Christopher Brandt. Mina Brewster.
Here.
Jean Drummond.
Here.
Senator Lamb.
Here.
Deputy Secretary Lord. Boris Lushniak.
Here.
Oluwatosin Olateju.
Here.
Maura Rossman. Nicole Rochester.
Here.
Michelle Spencer.
Here.
Elizabeth Crum on behalf of the Deputy Secretary.
Here.
Alan Twigg.
Here.
We have a quorum.
We have a quorum, so that means the meeting continues. It would have been less historic, right, if we didn't have a quorum, and a whole lot less convenient for all of us, and especially since we have a social organized later today, it really would have done a Debbie Downer on that social. So anyhow, so we can all go in saying we have a quorum, which means that decisions made today obviously are going to be binding and allows us to continue this incredible work of the commission. Sort of sideline comment, I think there was only one meeting. Could there have been one meeting, fellow co-chairs, that we didn't have a quorum in all this time period? Was there one, or there was one where we came close?
Yeah.
And did we ever have a meeting without full quorum? Shane, do you remember it all?
And I think with that,
Yeah.
we eventually had a quorum.
Right.
Yeah.
So anyhow, I do want to congratulate the commissioners that this work obviously leads to something so important, but it doesn't occur without your activism in all this. And the fact that we achieved quorum for all this time period shows me the dedication of these commissioners. That being said, I will go back to what I mistakenly had gone to. It really wasn't a test of Shane. It really was a mistake from the chair of not going to the agenda. I'm the first to admit the beauty of public health is we are there to take the praise where necessary. We're also there to admit mistakes in leadership roles when that takes place. So I blew it. Shane corrected me. Thank you, Shane, for your perseverance in keeping us, all of us co-chairs in line over this time period. This is going to be a whole afternoon of praising. That being said, are there any comments on the agenda? If not, I'm looking for a motion for approval.
Motion to approve the agenda.
Okay,
Second.
Jean Droman, and I had Clarence Lamb seconding that. All in favor of approving today's agenda, please say aye.
Aye.
Any nays? Any abstentions? We go forward with today's agenda. We also posted minutes from the previous meeting on September 11th. They were posted and distributed. I think we had a comment yesterday that with an update, Tosin put in the comment. I think that was distributed as well. So there was a modification of the initial draft. Are there any comments on the minutes? If there are none, I'm looking for a motion to accept the minutes.
Second.
I'm sorry, so moved from, okay, great, Alan, and second from Tosin. Okay, all in favor of accepting the minutes, please say aye. Aye. Any nays? Any abstentions? Okay, we move forward. Where we're at right now is we do have, according to our agenda, is for us to do have a discussion. Our major job today is going to be a look at the final draft report and for it to be ultimately voted upon. We, however, do have some changes and final reviews of recommendations that have come to our attention since the last meeting. As you recall, we had multiple votes looking at recommendations as blocks. We had some specific comments that came through. This one in particular is a final review of recommendation CCR-063, which is health-related funds. And I'll call on Mina to introduce the amendment for this and any other explanations about where we ended up with this recommendation.
Great, thank you. Appreciate that. Horace.
And if we can acknowledge you, press your button and.
Is it going to be queued up on the screen? Thank you, Horace. Appreciate that. So this is to talk about a potential amendment to a recommendation that we discussed a bit at the last meeting, and specifically it's CCR-063 related to health-related funds. So once it gets pulled up, we can start. But just to reiterate, as we, throughout the course of this commission, we've come to a place where we're anticipating this final report and the recommendations within to be not limited to the current context of the times of the challenge with the Maryland budget, or even the situation related to some of the federal changes we've been seeing. We're certainly recognizing the impact of these factors, but we don't want these recommendations to be limited by these factors. We still want to create a document that, with recommendations that the public health system and its partners within the state can refer to beyond these more immediate times as we work to improve our public health system. We've had significant discussions as a commission regards to the AHEAD model and have had invited speakers to come and speak with us about that and have talked about how that has an influence on Maryland's healthcare delivery system. But we've usually talked about this within the context of a broader discussion around what the role is of our public health system in working with our healthcare delivery system and healthcare financing system in achieving mutual goals of improved population health, but really improved public health overall for the state of Maryland and for Marylanders. And so with that in mind, and with deference to the remaining unknowns that we may have around the AHEAD model, right? I mean, the state is still negotiating some of the language with CMS related to the AHEAD model. We recognize that and know that the commission coming out with a recommendation around specifically the AHEAD model may be challenging given some of these negotiations and kind of the emerging situation there. But also, my suggestion is for us to take a step back and move back to the original concept of the discussions we were having around public health system and healthcare delivery system and healthcare financing. And to that, the original intent, I believe, is that there is investment into the public health system from all partners vested in improving public health and population health for our state. And so there's a proposal now in front of you, a recommendation that we revise the language of that specific recommendation based on some of the current day factors that we have to make it more applicable to whatever the situation may be years from now. And to specifically to remove the reference to the AHEAD model, but go to the core of what we're recommending, which is that the healthcare financing and delivery system invest in population health improvements and that there be a fund to support that investment. So I'll wait for it to queue up and then we can read out the exact language. I think it's further up. Yes, which page? So, and just to note, this is a bit unusual because I know we voted on the final slate of recommendations at the previous meeting. We did have some conversation about this and even some conversation about potentially delaying the vote on this particular recommendation until this meeting. The reason why I'm raising it is we've had some very helpful conversations since that meeting and also some time to realize that we hadn't fully addressed the public comments submitted related to this recommendation with the language that we voted on in the prior meeting. And so the proposed revision to this recommendation is where you see it here: reinvest savings from the healthcare financing and delivery system into a fund to advance prevention, population health, and public health. Supported strategy should be informed by input from a variety of public health stakeholders, including public health agencies, professional clinical associations, and community organizations. Local health officers as chief health strategists should be leveraged for steering implementations in their jurisdiction.
Great, thank you for that, Mina. So this is a change from what we had previously approved, and as explained already, it really sort of the focus here is for us not to latch onto a model that currently exists, but in essence, and an acronym that currently exists, but to make sure that this is further reaching, right? That people don't look at this report saying, well, AHEAD was eliminated or AHEAD was changed, AHEAD was this. It really gets to the spirit, I think, of what we wanted to do. So I'm looking for a motion for this amendment, and then we'll open up for further comments on that motion. So is there a motion put forward? And I assume, Mina, it comes from you. We'll put you as the point of record, but the motion is to change our previous recommendation and the wording on that recommendation. Do I have a second for that motion?
Second.
Okay, we have a second from Delegate Bagnall. And now let's have any discussion and comments on this. Jean?
Yeah, I just like.
Okay, hold on, Jean. We'll throw on your, so press your button. And Jean?
Good.
Just thank you so much, and I certainly concur with the broader piece of whether AHEAD goes ahead or not, we need to do this. But I also wonder, does this send a message? Do you think there'll be any impact on this, not removing the language that will impact our ability to get this for CMS? I mean, I just was thoughtful of.
So I would defer to our colleagues from Maryland Department of Health if they have any comments on that. But what I would say to begin with is this is more agnostic of the model and the mechanism. You know, AHEAD is a specific model, and then that's in negotiations and discussions, and the state's working on that with the federal government. But I think this is the concept, and this concept would apply if it's chosen to be attached to the AHEAD model as one mechanism, or if it's chosen to be implemented through some other mechanism or model.
I definitely understand, and I think it's great. I'm going to vote for it. I was just wondering, maybe from the folks at MDH, if there is any thought of we're removing the word, or is it possible to say something like, you know, this such as models like AHEAD or like other models? I just didn't know.
I think it, as revised, is is actually stronger for us because ahead isn't the only option, right? There are other things where you might want to more formally link the clinical delivery system with upstream public health. So I think this broadens the view a little bit and maybe opens us up to other opportunities that aren't as limited as one particular model. So from the Maryland Department of Health side, this works quite well, and appreciate the opportunity to provide feedback and pull up. And as you said, the theme of what you were trying to get to was really that connection and then the involvement in funding and the reinvestment of savings. So you've captured that, I think, really well.
Thank you, I appreciate it. Okay.
Remind you, if you need to say anything or want to say anything, press the button, and that way the light will line up and we'll be able to get your microphone on. Any other comments on this amendment here? Looking around the room, nothing? Okay, great. So we have a motion, we have a second, and now I will ask for a vote on accepting this amendment. And so everyone who's in favor, please say aye.
Aye.
Are there any nays? Does anyone abstain? Okay, the motion has passed. Okay, I'll turn to Shane to look at whether there are any other comments on any of other recommendations. So everything is as stands.
I believe so. If there are specific things, Sarah Bora, who is on Zoom, is prepared to provide us some overview, but other than that, those were the primary comments.
Okay, great. I will open up the floor to make sure before we get to the other thing is, as the commissioners had the opportunity to review all this, are there any other comments on specific recommendations? Not to open up, you know, a whole another discussion, right? Things have passed along the way. As we're reaching this next stage, and I'll remind you, the next stage after this is the representation on the final report and ultimately a vote on that final report. But if there's something that's causing dyspepsia, if there's something that's causing, as my mother-in-law used to call agita, if there's something other than, we know there were, you know, elements that did abstain from some of these only because of, you know, perceived allegiance to, you know, government aspects where there was a discomfort to make sure, you know, we realized the abstentions were out there. We, however, have been pretty open in terms of having this type of discussion throughout our commission. So this is a last chance before we move to the specific discussions of the final report draft and the feedback on that draft. Anybody have any issues regarding any of the recommendations as they currently stand? Okay, if not, then we shall proceed. We are going to be ahead of schedule, Shane. I'm just going to warn you on that because we had set aside a little time, but that's okay. In the old days, Matt used to provide snacks. We don't have the snacks here, but we do have, and those were glorious days, Matt. I used to take home full dinners worth of unhealthy things, but yeah, times are changing. But I didn't say that. For the record, let's strike that about the dean of the School of Public Health eating unhealthy things, so let's not go there. But as opposed to having a short break at this stage, because we just started, and I think we will utilize our time at the end of this meeting for several purposes, including picture taking and things like that. Shane is giving me a signal, which is this, which means stop talking.
No.
So I'll give Shane the ability as our...
No, not so much. Actually, a plug for Sarah and the folks who are working on our laying out the report when we get to that. There are several of you who have not provided commissioner quotes, which we would really love to get a quote from everyone. If you believe you are that person or are unsure, please see me or Megan Roney. Wave your hand, Megan. She and I will happily get that information to Sarah for you. So in light of Boris sharing that we are ahead of schedule, this is ample opportunity or guided study hall time.
Yeah, and these quotes are important. Several of us submitted them. I submitted mine rather late as well, so don't feel bad. Mine went in yesterday. But I think it is important that we as the commissioners at least give a feedback of how this process was for you, right? You know, tell the truth. and yet be proud on what you did. And I think it adds credence for us, including some of our feedback, right, in terms of how you felt about all this. So we'll have ample time, and we know who you are. You know who you are. And somehow, since we know who you are and you know who you are, we will bring you to a quote at the conclusion of this meeting. So anyhow, thank you so much. That being said, let's move to item 5 of our agenda here, which is the overview of the final report draft and feedback. I do also want to congratulate many people here, and in particular Sarah Bora, who's not here with us in person but is out there. She'll always say that it was part of a team, but Sarah really has been leading a charge of multiple such drafts. And as our time period of having these drafts sort of went on, there was feedback, there was tight deadlines, there was, the gnashing of teeth and tears and we thought it was over and then it wasn't over. There was a lot going on. But I'm happy to say that we survived all that, right? To the point where I think there is something out there. If you've looked at this report, we've seen several drafts of it as commissioners. I hope you had a chance to review it because shortly you're going to be voting on it. But I do want Sarah to begin sort of the process of discussing how this report, where we stand right now and what we're shortly going to be voting upon. Sarah, please take it away.
Yeah, absolutely, Barson. I appreciate that. And I apologize for not being able to be there in person with everybody. I am sad to miss out. My excuse is that I have a due date of a baby in 2 weeks from today, so I was not able to get onto a plane. But I echo what Boris said, in that I hope everybody has had a chance to look at the final draft that we shared earlier this week. And I hope as you saw it that your thoughts and takeaways were to just see how amazing it is where we are with this report, the breadth that is covered in it, to include all of the hard work done by the assessments, by our academic partners, by everybody in the work groups, as well as the results through the wide array of recommendations, the continued discussions that are shown in their final form. So hopefully, as you were looking through this, that is what you were able to see that in the report, and feel very, as I do, proud to be part of this process and of this result that we have here today. Just a couple notes to say as we discuss the report today. One to be that we will have a final editorial review. We have a copy editor who will be doing a very thorough review of the report. So if you are noticing little errors in that, whether through grammar or through formatting, please know that we are planning on to make sure that those are caught before the final version is shared. Also that although we were unfortunately not able to share it today, we do have a design team that will be putting this report into a more dynamic and colorful and version that I'm very excited for everybody to see, that I think will really bring a lot of energy to the report as well. But really, as you all as commissioners really wanted you to focus on the most important part, which is of course the content, which we sent out to you. We've had a few minor changes since what we shared earlier this week, but I would say that they are minor changes, as I said, just to grammatical errors. I would encourage everyone, if you haven't already, to make sure that your name is correct in your position, or any other sort of part like that, because those are definitely very easy mistakes to make. So if you haven't already confirmed that, please do so and send that to us. I believe a lot of that was based on what we put in the interim report, so should be correct. If there has been any changes, or if that was not correct, we would definitely want that to be updated before we publish the final version. And then, although it already, of course, just had a shout out right before I started, but as you look at the report, you can see there are those commissioner comments. We have about 5 right now, I think. So I would love to have everybody who is interested to submit their comments. So please do so by the end of today. The most important deadline for all of us to keep in mind is October 1st. That is when this report is due. So as we're thinking about any additional changes, any additional text to add, especially as I mentioned, with the knowledge that we are still trying to make sure that there are no grammatical issues, that it is designed correctly. Time really is of the essence, and that we have to make sure that we're able to hit that October 1st deadline. So those are my overarching comments to set the stage for this discussion and vote. I don't know, Shane or Boris, if you'd like me to go into any other depth of anything, if we want to look over anything in more detail, or if there are any general questions that I myself or anyone else here could answer.
And we do miss you from being here. We also realize you also have a deadline. And I'm not sure if you heard all the clapping and cheering directed
appreciate
towards
that.
you, and obviously good vibes and well wishes. That being said, Sarah gave us an overview of where we're at with the report. Again, we realized this was, in your hands for a relatively short time period, but it was the expectation that the commissioners would, by this point, have looked through it. I now open up a sense of, I guess we can start first with a motion to accept the report and then go into comments, or we can start just with comments without a motion. So let me start without a motion at this point and just sort of go around the room. I won't be calling on individuals, but in essence is, as you looked at this report, and I'm looking both for any criticisms that you may have that are, potentially done later on as a form of a amendment to a motion that will put forward of accepting the report as it is, or any praises that you've seen that you would like to share with the group. So we are now open to the discussion in general without a motion before us about the report itself. So commissioners, you now have the ability to say something, and once again, press the button if you are ready to say anything. Okay, Mina?
Yeah, I'm wondering if we have the time and it's helpful, perhaps we could show on screen, kind of not go through line by line, but at least show the sections of the report, since we have a little bit of time built in. That might be
Okay.
helpful as people are thinking about thoughts or suggestions they may have.
So just scroll through is your recommendation?
My recommendation, if people
Okay.
feel like it's unnecessary.
And those of you may also have the report in front of you as well on your own electronic devices. But let's get it on the big screen, and we'll take a moment to just slowly scroll through to get once again where we're at with this report.
Actually, Sarah, did either of you want to guide us through, or do you want us to do that?
Yeah, absolutely. And I'm also happy to share my screen and show whichever way, Shane, is easiest for the commission. So starting here as the just a table of context, just to as you said, Mina, to think through the different sections that we have of the report and the way that it's been structured. the basic sort of story that we tried to tell through this, beyond the acknowledgments and the remarks in the summary, and the acknowledgments, of course, which cover a lot of people and lots of organizations, and of course also is in the appendix with all the various many names of people who contributed to the work groups and contributed to the assessment, and the interns, and all of the different people that went into this report. So I encourage you, if you haven't seen or looked there already, to take a peek and to see all those names. But the story here that we were telling is to start with what we did, who we are, the commission, the need. So really focusing then on the assessment through both the academic assessment, an overview of Maryland, and then the findings from the work groups, and all of the hard work that went there, resulting ultimately in the series of recommendations, which I know all of you have know well at this point, and have debated and spoken about and read many times. So that being, of course, really the big focus of this report, and what is such a what we're so proud of and excited to put forward. And then concluding in the moving Maryland forward. So what are those next steps? And as of course you'll hear several times today, and I know Boris already mentioned, this is of course not the end of the commission today, is put as well as, and certainly not the end of the work that is being set out to be done. There are lots of next steps that need to be taken by everybody here who wants to make these recommendations and this vision a reality. So that's just sort of to speak through the overall structure of the report. And then of course, the very comprehensive appendices that has many different parts to it, including so detailed methodologies to speak to some of the assessment activities that are done by our academic partners, a repetition of all of the recommendations organized by work group to make the recommendations more accessible. So we have them listed twice, both in the recommendation section and then again at the end. So and organized by work group to acknowledge the hard work done by the work groups, and also just to hopefully make them accessible in a different way. And there's also a synopsis of the response to open comments. So a summary of what we received by open comments and what those looked like. So if we continue to scroll down, we can look at each section, the letter to the assembly. And of course, please, I'm not that I can hear everybody out there, stop me if anybody wants me to stop anywhere. But commissioner's remarks, which we've mentioned several times now. Thank you to those that have provided them already. The acknowledgements, which is comprehensive. Executive summary, trying to take this 100-page report and put it down a little bit shorter. But we tried to capture as much as possible there. We have a listing here, once again, to speak to the recommendation titles, and they're organized by theme. Just once again, if you are ever interested in sort of getting a big picture view of the recommendations and are wanting to reference them, know that they are also here in the executive summary. Then going to the what we did section, as summarized before, really speaking to the commission's, why the commission was created and what it hoped to do and to achieve in the state and the organization. I will note that of these images, just as mentioned before, as this report is being designed, the final version of the images and charts and tables in this report will be more stylized and more standardized. So this section really goes over the different steps and to remind you of all the different assessment steps that we took, and it really is very impressive when you see it listed like that. And then summarizing here about some of the basic structures of Maryland, and the what the needs are in the state. Then in this section, and I'll pause just quickly. So when you move to the findings, you will see that a lot of this is taken from the assessment report, which is on our website. So definitely encourage you, if you have not done so already, to look through the full assessment report created by our academic partners. It goes into more depth about a lot of the topic areas that are brought up here, but this section is pulled from their work, and it highlights a lot of the areas that they considered important. So if you're wondering where this came from, as well as really encouraging everybody to look at that full report if you haven't already. And you will see that a lot of this, not all of it, is organized by the various work groups, but there are also special other areas that are called out. And I think we can just keep on moving, Shane. So here, and just a quick pause to mention some of those specific areas that go beyond the work group, some of those cross-cutting areas. Some of the ones included here, you see our overdose, maternal mortality, maternal and infant mortality, and other areas that the commission was asked to look into during their assessment. And then, of course, once again, the most the very exciting part of the report. I think they're all exciting, but then the recommendations are here. We've spoken. You've seen several times about the way in which we've organized these recommendations into larger themes, and then from those larger themes into strategic objectives. This is a way that we're to make them more applicable, more action-oriented, and to really showcase the way in which they are interconnected to each other, since it really covers such a huge variety of public health areas. And you will, of course, see that each recommendation has its tag, that the language specifically for each recommendation is what was voted on by this commission, but there is also some additional narrative added just to add some context from the state, as well as, once again, to sort of illustrate the way in which some of these recommendations interconnect together, and to create a larger narrative for the report, to speak towards the vision of the commission, which goes beyond one individual recommendation. So it is, of course, very exciting to see all the hard work from the work groups, from the assessment team, from you all, everybody here as co-chairs, the co-chairs, the commissioners, to see all these recommendations here. It's a long list, and it's really very, very exciting to see. And then just a quick pause, Shane, to speak then. Now that we're getting to the end, we have our areas for future exploration. So this is some of the topic areas that were brought up that did not become full recommendations. Whether it was because we did not have the time to fully develop them, we did not have the resources to fully explore them. There's a variety of reasoning. But we thought that by listing them, at least here, we could honor the thought and the process from the work groups and from the members of this commission put into these areas and put them forth for any future group that would like to take them up. And with that, to speak really to the future and to what action steps can be taken to make sure that, as everybody, I believe, has said several times about this report, that it's not something that sits on a shelf. That is something that that creates action and creates change. So, speaking to the importance of you all as commissioners, of the partners, of everybody who is interested and invested in public health in the state, and in the role that they will take in making these recommendations something that is achievable. Whether it's now or some time in the future. And then we'll move through the appendices. I know some of them are more exciting than others, but you'll see we did try to make sure that all the information, all the references, everything, our speaker presentations, which are of course very important to the development of the work here. All of you as commissioners, and once again, as I said, please make sure that your name is correct. And just to speak once again to all of the many, many names of people who are involved in this process, and the many, many organizations and groups and institutions that were engaged as well. Just a quick pause here, Shane. We built off the timeline. This wasn't our assessment report. We did try to capture some of the key health efforts in Maryland to contextualize the work that was being done in the commission. And then, as mentioned, here is another listing of the recommendations as organized by work group. So this is another place to reference them. As I keep saying, the final formatting will be a bit cleaner and more consistent. You can see that it is still just in a table, but wanted to make sure that you knew that that would be there. And that takes up a few pages. And then going into more in depth of the what comments we received, so summarizing those, and some of which resulted in changes to the recommendations. And then a detailed assessment methodologies to speak to better keep track of and understanding if you have questions about what was done by our academic partners and the assessment team. And I think that might be the final section there. So I appreciate everybody hearing me speak so long. I know we also just have the just all the citations, which I believe are not on this side, but we do have citations in another version. But once again, I'll open it up for comments or for questions. Also, just want to thank, and can do it so many times, everybody that was involved in this, but a special thanks to all of the support staff, Dushanka, Shane, Megan, Amelia, everyone who are contract writers, all of the people who were put a lot of blood, sweat, and tears into getting this to this point. So I will stop talking and see if anyone else would like to talk.
Thank you so much, Sarah, for that overview. And I think actually as you did that, there were several sort of comments that I was getting as a proxy to others that I'll bring up shortly, and has nothing with substantive changes other than perhaps changes of order of things. And that's sort of where we want to be at this stage. Mina, however, did press her button first, so I will go to Mina first.
Just to thank Sarah and you know, the whole team who is working on getting us to this point. Thank you.
I'd also at this point saw that Chris just showed up, so I do want to acknowledge that we do have Christopher Brandt. Chris, thank you so much for being here. You probably parked where I did, which is in Baltimore somewhere. Anyhow, great to have you here. So let's add Chris to the So I did receive a comment from part of my team who just wanted to bring up a discussion amongst both, you know, our writing team as well as amongst the commissioners. And that's specific. I love the way we finish it, which is moving Maryland forward. The question that's come up is the one page on areas for future exploration. Is it a better fit for flow that this section would be put in after the findings rather than after the recommendations? They do refer to recommendations, but these are recommendations that were ultimately not passed. And so that really is a question to everyone here, is a matter of flow. Mina?
My thought on for recommendations that didn't pass, that may even be appropriate for an appendix, perhaps. I think the moving Maryland forward is about how are we transitioning, how are the recommendations that did pass going to impact and be implemented, but we could certainly consider the ones that didn't pass, but they didn't pass for a reason. And so I wouldn't necessarily overly emphasize them at this point in this report.
Any other comments? I will also turn to Dushanka, who's at our table here, who played a key role on this. Any comment on the flow of this from your perspective?
I feel that the information being provided in this area is important for people that are going to take action subsequently. Wherever it sits, I think I'd be supportive of it being in the appendix or any other place. As long as it's referred to. And I think that way it will be much cleaner going from the findings to the recommendations to moving Maryland forward. But in the approach to the assessment, maybe mentioning that there were things that still need pursuit in the future when there's time. Thank you.
Yes, Shane.
I appreciate Mina's point and Dushanka's follow-up, and agree that recommendations that didn't pass, there was some rationale for that. And so we, in crafting the areas for future exploration, didn't use the verbatim language of the recommendations because we didn't want to put that forward in the sense that you know, somebody else should run with it as is, because you know, obviously there was something that either we needed to do some more research or we just couldn't quite come to consensus on that particular item. So what we tried to do there is synthesize more the thematic approach of what the recommendation was trying to do. So to use maybe an example that we might all recall, instead of talking about local health departments as quasi-agencies, we reference that as restructuring local health department governmental structures, with the idea there that, again, that really was, as presented, something that the commission felt needed a lot more conversation and thought behind, and that we didn't want to put that forward solely, thinking that it was, for lack of a better phrase, a shadow recommendation hiding within the document. But I just wanted to highlight that we understood that concern as well.
Great. Other comments on this? And again, as we put it up for vote, if people do want to put in amendments in terms of ordering or how we do specific sections, we can certainly do that as amendments. Any further discussion from individuals?
On that,
Yeah. Yeah, Jean, anything, right? So Jean, you have the floor.
So, couple things. One, I wanted to say that I thought overall the geographic diversity of Maryland was represented in the document. Because it's so different. Eastern Shore, Western Shore, all of Baltimore. And so I think that's important from a public health. The second thing is that it's very actionable. And we've all seen those reports that just look beautiful on a shelf but don't really move forward. And so really wanted to say that. And the range of things that I think we did, from workforce policy to so much. And then the last thing I would say, I've been on many commissions, and having support from a paid working staff means the life of a difference. It's not just volunteers. So I say that so that we can make sure that that's, I think, the pivotal piece. To have dedicated staff who's working on this helps to carry, so that commissioners can come in, bring expertise, right? But you have someone that's really carrying carrying the vital water, because we all live with water, so it's important. So I just really want to say that and have that on the record, because we can think of all these unfunded mandates and they go nowhere fast. Yeah.
Great, thank you, Jean. And certainly we do reflect on that, as we close today, we'll sort of be talking about not only next steps for our commission, but in essence reflecting on also what worked and what didn't work. And I do want that to be part of a theme. So, I slowly in my own mind expand that last section, not just sort of just a simple closure, but in essence is to get that feedback from commissioners in terms of, but thank you, Jean, for your comments. Back to the report as well, any other comments in terms of how things look right now to you?
Just structure.
Yeah. Yeah, so let's just keep structure, because I do want at some point to finish this part. We then will have a short break, so we're sort of at a break time that was initially introduced, even though post may go a little bit more quickly, but I still think it's worthwhile stretching for the good of public health and also for the good of, I haven't talked to Chris for a while and I want to shake his hand, so. That being said, any other comments in terms of the report, the flow, the structure? Okay, if there are none, this is sort of the drum roll moment vis-a-vis this incredible work that's gone in. So I'm asking for someone to put in the motion to accept the report. We then will have a second. We will then have the last potential of discussion. So if anyone feels strongly about changes of what goes into an appendix, what stays the way it is, we have that during that, because it becomes amendments to the initial decision point. But I'm looking for a motion for accepting this report as is.
So I'll make a motion for the commission to adopt the final report with an understanding that there'll be some necessary copy edits and design changes of the report as it goes through its final process.
And I think that's a key stipulation, because it is not our intent. Everything will be circulated around, but this is really our last vote on content, right? The photos, the sort of the making it pretty and all that. We will not have the opportunity to have another public meeting before October 1st to do that. So thank you for that stipulation. Do I have a second for that motion?
Yep, second.
Okay.
Thank you.
So we have Mina as putting in the motion, Tosin is putting in the second. Is there any discussion on this motion as provided, the wording provided by Mina? Great, thank you, Chris. No discussion on this, so I will put this up for a vote. Those commissioners who are in favor of putting forward the report and accepting the content of the report as it currently stands, with the understanding that there will be some copy changes and design changes prior to it being submitted. All who are in favor of that, please say aye.
Aye.
Are there any nays? Does anyone abstain? Wow. I just wanted to do that because I literally, in my whole career, in all sorts of public health leadership, delegate, I never had a gavel. And that was done spontaneously. It was to come truly from the heart, from the spirit, with all the joy. And I'm sorry, is your right ear okay?
Say the motion passes.
The motion passes. Sorry, I forgot about it. I got so excited about having a gavel. But yeah. You know, as formerly the acting Surgeon General of the United States, they never gave me one of these. So I got to say that this position as co-chair, they knew why, exactly. That being said, we'll get back on track with having a short 15-minute break for us to be able to take in the joy of this stage. We will then come back, and we have asked, as part of that, both our senator and our delegate to provide some wise words initially as a form of discussion of how they view this commission and also the path forward for this commission in our last few months of existence. And then we'll open up to the group of talking about what are the options of us still acting for the good of this report, i.e., as I perceive it, as an implementation phase of this report. That being said, let's take a 15-minute break until 3:30. Thank you so much. I will ask everyone to start taking their places here. It's now the 3:30 timeline. Thank you so much again, and it was great talking with people who are here. Today's a great turnout of events for this, what will later be an evening celebration. We'll get details after the meeting to make sure that we're able to all both reflect on what we've experienced, but also to feel the joy of our accomplishments. You know, as we bring up this last segment of our last meeting as a commission pre-posting of the report, and I will once again talk about this idea that there's a term that, of course, Shane, who's really been helping us a whole lot throughout this whole process, introduced, and I actually had 4 years of Latin in high school and still had to look it up, right? Because at some point where you can see, I think it's on the report, it's adjourn sine die. Sine means without. Die is without a date. So when we adjourn, we basically don't do what we usually do at the end of these meetings and say, here's the next 6 meetings and here's where they're taking place and they're hybrid and you know, we're going to be doing this and here's the timeline. So sine die doesn't mean that we stop, it's just that we stop this phase. It's without a date. Without a date of us getting together at this point. But once again, when we were appointed by the governor's office, when the legislature had the wisdom of putting this commission together, the idea would be that 16 of us chosen, and by proxy, those chosen or choosing to work in the work groups, in all the aspects of this commission, those who were staffing this, whether through our academic institutions, through the benevolence of the benefactors, and specifically the organization of the CDC Foundation, right? We talked about elements of what led to this success. What leads to a report that I think is of the highest caliber in a relatively short time that we believe has impact? That, as I think Jean talked about, is actionable, right? That we can do stuff with. That isn't just fluff. It takes that village, and there's many aspects to that village, and we'll certainly acknowledge this through the rest of today. At the same time, since we are with sine die, we also have to talk about what do we want as commissioners, right? The date is June 30th, I believe, per the changed legislation of the end of this commission of 2026, which means that we enter a new phase. We've talked about the proposals of what that phase could look like, right? Sine die means we don't have a next meeting, but that doesn't mean that at some point it becomes apparent that we need to have a meeting. And that could just as well happen. We can put it out there and saying we have something to discuss. I think all of us deserve a little bit of a break from this work, a little bit of reflection, but also a quick shift to be able to say is how do we implement this? So this is going to be sort of the discussion as it comes on in this last segment. I want to remind you, and I again enjoy the conclusion of the report, page 76, as we talk about moving Maryland forward. First of all, part of it is the pride we should have as Marylanders of what we've achieved. This could very well be used as a national model. We hope it is used as a national model, and there already are signals out there that the nation, the states, the locals, throughout these United States and perhaps globally will be looking at this and say, what did they do there? But ultimately, our jurisdiction was moving our state forward, a state that I personally have been a resident of since 2004. Right? This is the latter part of my career in the state that I've grown to love for its beauty, for its people, for its attitude. I'll remind you that that first sentence of Moving Maryland Forward talks about our vision, where, quote, every Maryland community flourishes with equitable access to comprehensive public health services, empowering everyone to achieve well-being and improved health outcomes. Right? We have to feel that. We can't just look at words and say, you know, yeah, that sounds really good on paper. And I believe this commission and the whole village that came with this commission remains a believer in that. Which is why I want to begin this segment of talking about is it enough that we've done this already? Is it enough to issue a report and then turn around? If we truly believe that we want our communities to flourish, equitable access, comprehensive public health services, empowering the goal of well-being, improved health outcomes. What else do we need to be thinking about? What else do we need to be doing? So in the short run, what are the ideas? I'm going to ask Shane here to just briefly give us a litany of the next few weeks of what we're thinking and, in fact, what's been set up. And although this is not done under the auspices of commission meetings, but for the commissioners and all the village, the team, the working group members are aware of this and are able to support some of these activities. So let's start with Shane, and then I'll take it away again afterwards. Shane.
Thank you, Boris. You know, as Tosin and I were riding the elevator up together to come to the meeting, we both kind of remarked that this discovery phase is concluding, but we're now moving into the implementation phase if we wanted to look at this from a sort of project cycle. And so the work really does continue. In that vein, obviously, we are looking very closely at the submission on October 1st to the legislature as well as the governor's office. We will handle that as we did with the interim report. And so once everything's finalized, we'll get that submitted and then, of course, share that information out with all the commissioners, make sure the website's updated, as well as making sure the Secretary of Health receives copies and so forth. So that's the immediate next week or so of work that we're focused on. After that, we are planning to have an event on November 13th to really make sure that the energy and momentum around this effort is continuing to move forward, particularly as we move into you know, those late weeks of the year that precede the start of legislative session. So on November 13th in the afternoon, we are expecting to host an event in Howard County where commission co-chairs and some other folks who've been engaged in the process will go over not only the final report, but also the 3 briefs that are being produced. And those 3 briefs, you may recall, we discussed in previous commission meetings, are meant to really be more bite-sized material that you can use in having conversations with key stakeholders, different associations or trade groups, and of course with legislators or others who may be interested in learning more about the process, but don't really have the time to consume a full 150 pages of report. And I'll just note really quickly in that vein, the report is also designed such that that executive summary section really could kind of be a tearaway and provide you enough substantive information about this process that you know really would get the real bulk of the information and the sense of where the effort lies ahead. And so if somebody is really pressed for time, but wants to have at least, you know, a surface level understanding of what the commission did, as well as what the recommendations are, that executive summary really does kind of span the gamut of that, and up to and including the thematic listing, the strategic objectives, as well as the recommendation names. And so it really does give someone who's interested a chance to dig in more deeply without having to consume the entire report in total. So going over the final reports at that November 13th meeting, as well as the 3 briefs that I mentioned. And the topics of those 3 briefs are government efficiency, really capitalizing on some of the conversations that we heard in focus groups and listening sessions about opportunities to take the resources that we have and the administrative processes that are there and streamline or find economies of scale. The second topic is leveraging and formalizing partnerships, which of course is an entire theme within our recommendations. And then similarly, bridging public health and healthcare service delivery, where we really kind of take this, I'll say, novel approach in the sense that I really do believe Maryland's leading the charge on this, of trying to break down those barriers between the silos of clinical and public health, recognizing that in order to achieve the mission and vision that Boris just read for us, requires that those 2 systems work not just interdependently, but really in lockstep. So we really look forward to keeping this work moving forward. I believe MACHO will be helping pull some of the details of that November 13th date together. The CDC Foundation support staff, which includes me, Sarah, and Megan, are working with Ruth at MACHO to help get her all the information she needs, as well as brainstorming on some potential logistics there. But we, as best we can and with the resources we have really tried to prepare kind of a runway for the commission on this implementation phase, recognizing that to Jean's comments, you know, we may not have the full level of support staff to support this work immediately into implementation, but there are some folks who are kind of answering that call. And so I want to acknowledge those folks who have been helping us do that. So happy to take any questions, but that's kind of what we've got on the deck there.
Great. Any questions for Shane? So that's the next few weeks. I also want to acknowledge once again the important role that the CDC Foundation staff, and again through the benevolence of CDC Foundation and their supporters, right, that we've been able to achieve this. We, however, have to also acknowledge that we do have this opportunity today to say goodbye to that staff, because that time is a-ticking. What's the official date? The 1st of October? I thought it was October 6th or something, wasn't it? Wasn't there an extra day, Megan? Do you? The 15th. Okay, so around October 15th is where officially the CDC Foundation pulls away, right? And you know, and it is the right time post-report. We do appreciate all the support, but that means, to be honest, from the Commission's perspective, part of our support mechanism and expertise goes away at that point. We'll have to be discussing sort of roles of other groups that can potentially step in while we look at, you know, MACHO as a potential partner with our commission. Certainly as the Dean of the School of Public Health at the University of Maryland in College Park, I will pledge the fact that we will remain engaged, and it's still to be determined, the further engagement. And the reason we stand out, you know, as part of that engagement is, first of all, the 2 people to my right and left understand we are a state institution. And part of our goal as a state academic institution is to make sure that we are doing things for the good of the state. So it will be incredible shoes to fill and roles to fill, but we will figure out something in terms of us moving ahead as a commission until June 30th. At this point, I also want to mention in that last page gives us a little bit of marching orders for the commission for the future, right? It talks about the action steps, and it talks, first of all, as we had talked about, in terms of us having galvanized discussions between so many partners, right? The public, community partners, policymakers, local and state government entities, health-related organizations and systems. So, first of all, our marching orders is that the commission is enthusiastic about continuing these important discussions in the spirit of collaboration and consensus building. Secondly, right, we talk about how many of the issues that we touched were interrelated, different health challenges, there are different levels of complexity. That we push forward for one of our recommendations, and we need to be out there that this is critical, that the recommendation to establish a public health resource team that will be essential for securing the personnel needed to coordinate the work ahead is part of our marching orders in our report. Third, and we'll hear from our policymakers, legislators shortly, but it's that the briefings for policymakers by commission members will provide additional details, right, on operationalizing some of these recommendations. And these meetings we foresee will continue until the commission sunsets in June 2026. I think it's critical that all of us look, and this will be part of our discussion shortly, is how do we stay connected, right? Do we do a listserv? Do we just stay on email connection? The commission still remains as a commission, and I expect that no one is going to tender their resignation after this report. It is up to you. We, in fact, are still trying to fill in some of the vacancies because we think this implementation phase are critical for us. So if you've been thinking that I'm done with this thing, please reconsider. If you are thinking about resigning from this commission, I'm being that blunt, talk to me or one of the other co-chairs and we will talk you out of it, right? Just for a few more months, that's what my job is, right? But think about this idea of, we're thinking about putting together a slide deck so you can use that, right? Presentations that you're doing, networking that you're doing as commissioners, the process of comments in the future, right? We may have to bring the band back together if, in fact, the commission wants to vote on a statement that we put out as legislators are tackling important things, right? That'll have to be a public meeting. It'll take the idiosyncrasies of that, but that doesn't also stop you from individuals from being part of the group that in essence supports or doesn't support aspects of this reform that we're calling for in the future. So the briefings, I think, are important. And then fourth, the prioritization, right? So we need to prioritize categorizing the implementation order recommendations. And we ourselves know there was always this danger, right? And the danger we're reminded time and time again by the dear delegate and the dear senator here, which is, we can't just throw a ton of money at this and pretend that's going to solve our problems, right? We know we have a very difficult legislative session coming aboard, and we'll hear again shortly from our legislators about this. So the simple mix isn't just, we're going to buy ourselves out of this trouble. We're going to have to think of innovative and efficient ways and prioritize things accordingly. And as we have been very transparent throughout this process, some of our recommendations may be able to be done overnight. Others may take years. Others may never happen. That's the reality. But we at least have done due diligence to come up and say these are issues that will ultimately improve the public's health for the state of Maryland. So that's my opening statement, believe it or not. It sounded like it was both an opening and concluding statement, but we gave a warning, at least I gave a 24-hour warning or so to the good delegate here, and the good senator got a warning about 2 hours ago that we're going to be touching this. So I'll allow the delegate to begin with her reflection of how this commission can function, but also her reflection as one of the legislators that was critical to the functioning of the commission. Delegate Bagnall, please.
Thank you very much, Dr. Lushniak. My chair always says to speak from the heart, but I suspected that I was going to get a little emotional, so I did write things down, but they are very much from the heart. And I wanted to make sure that my comments were also meeting this moment, because we are in a very unusual moment in our history, right? So this has been quite a journey. It's funny that you used the word novel. I did as well. This report before us is a novel start to improving Maryland's public health outcomes post-pandemic, and it does create a framework which other states can emulate. And it will continue to inform our state for years to come. For over 2 years, the dozens of experts in this room and on the other side of the live stream have met consistently to ensure our state has a clear vision to improve health outcomes and ensure consistency and care for all Marylanders in a way that is thoughtful, impactful, compassionate, and based in real health data and real-world experience. For that, we should be incredibly proud of the work we have accomplished so far, and I am humbled to be a part of that effort. Now, as we celebrate the completion of this report, we know our work is not done after its release. For any of these recommendations to have a real impact on Marylanders, we will have to change laws and regulations and systems of health, and even our way of thinking, even our belief in what is possible to match the vision in our final report. I am certain our good senator intend to be there every step of the way to help guide any changes in the law, but this is not a job we can do alone. Convincing 140 other delegates and 47 senators that the recommendations in this report are worth the time and resources they require to implement them is no easy task, and we will need expert help to get that job done. We have many friends in the legislature who share our vision, but we also have many who will need some convincing. What we have created is comprehensive and it's transparent. In a time when expertise, trust, and investment in public health may be in short supply at the federal level, in this room, we have dozens of professionals representing hundreds of clinical hours and decades of institutional knowledge serving Maryland. And this document has not only created a vision for our future, but has memorialized that knowledge and the process of achieving that vision. You are our experts. You are the voices who can provide their expertise to decision makers who will be looking at this report and weighing the extent to which they will support these recommendations. We've already asked so much of you, so I am loath to ask more. But I know your passion, and I know your commitment to seeing this through. So to all of you, I have a request. We in the legislature need you to write op-eds, provide committee testimony, have meetings with elected officials and members of the administration. Help us push for these recommendations that you have worked so hard to produce. Maryland continues to be a state that relies on our experts to help us make decisions for the good of our population. And it is only with your continued advocacy and input that we will see real progress in implementing these recommendations. I thank you from the bottom of my heart for the work you have all done to get us to this point. I thank you for seeing the challenges we are experiencing as opportunities. And I thank you, and I thank my chair, and I thank our Speaker of the House for entrusting me in representing the House in this work. I look forward to continuing the work with you to see our aspirations translate into action. And I know that you are going to help us by holding us accountable. Don't stop talking about it. Because I truly believe years from now, we will reflect on this moment and this work, and we will look back and know that we were a part of a transformation for Maryland. And that is a very big deal. Thank you.
Thank you, Delegate Bagnall. Senator Lamb, reflections from your perspective?
Sure. Well, thank you, Dr. Lushniak. It's been a pleasure to be here and an honor to participate as part of this commission. You know, and just a few moments of reflection. I think, you know, Delegate Bagnall was there as well. I think you were the House sponsor. It
was the chair.
It was the chair. Okay, well, Delegate Bagnall was certainly instrumental in shepherding the bill through, because I remember, you know, this was now 2 years ago, where it took a lot of effort to get this through the 2023 session. And, you know, just to think back and reflect on that time, this was basically a year after the pandemic had ended, right? And many of us recall vividly, you know, what that was like over those 2 years of the pandemic. And this was an opportunity for us as a state and also as public health leaders to recognize that we had a real chance here to do a gut check, to figure out, you know, now that we've emerged from you know, the worst pandemic that we've had in modern history, you know, where do we go as a public health system, as a state health department, as those who are good stewards of public health programs and services, where do we go with that? And, you know, it was a recognition that with that closing, in some ways, we had an opportunity to do a reset, to do a gut check, to think ahead and see what we could do in terms of planning. And, you know, had the opportunity through many, you know, hours of discussion as part of this commission to be able to craft together an amazing report, one that all of you as commissioners and the public as well has spent many an hours to be able to provide input of, you know, great thought, careful consideration, edits, suggestions, recommendations, and your outreach to the community has been truly impressive and also integral to this effort that we know as leaders in our own right, in the many different hats that you wear, in the fields that you're involved in. We only know and can do so much. We depend on being able to hear from others as well. And I know many members of the commission have certainly reached out to others to be able to pull those thoughts and recommendations together to make this this work a public work. Right? And that's incredibly important because we know as public health leaders, there's nothing that we can do without the support of the public. We saw that during the pandemic. We will continue to see that in a lot of the changes that we try to implement when it comes to public health as well. You know, we've come a long ways, I think, when you think about many of the meetings that have taken place. And I know I came into this mid-process as well, but have been monitoring it even prior to that, these recommendations all come from the heart. They're well thought out. They give us a good roadmap towards the future. And that's where, you know, I'd like to end and kind of touch on that. As Delegate Bagnall mentioned, you know, this is, and we've mentioned this in the meeting several times, that this is a living document. This is intended to provide a roadmap that there is, it's unlikely that we'll be able to implement all of this at once, which means that we will continue referring back to this document, to this roadmap, to figure out what those next steps are, to be able to point back to the work that all of you have done, to say, look at what these brilliant leaders and experts came up with that still needs to be done and addressed. And as we go into this initial legislative session, you know, we will certainly be looking at the recommendations to see what we can help support and implement. But we know the legislative process is never easy, and this is one that will extend beyond one session. And, you know, a few, you know, as Boris mentioned, you know, the formal work of the commission may be done, but as commissioners, your work continues on because we will need to continue to hear from commissioners. We'll need to hear from all of you as to why these recommendations are important, to be able to advocate for them amongst our colleagues, to come before our committees to testify and come to our hearings. So that, you know, we are only two legislators to be able to advocate for this commission, and we'll continue to do so and be strong champions for that. But we have a lot of colleagues where being able to hear from the public, being able to hear from constituents, being able to hear from subject matter experts like yourself, is really meaningful, will help move the needle. And we'll continue to work on it, not just during this upcoming legislation, but for sessions yet to come, to know that this is a living body of work that we will continue to refer back to, that will provide us a good roadmap to really elevate our public health infrastructure to unprecedented heights. And so I'm really proud of all the work that you've done, because we could not be here without all of your support. And the time that you put into this will leave a living legacy behind for all the subsequent public health leaders that are coming behind us to be able to continue to uplift and advance. And we could not have done that without all of your support. But don't give up, don't leave, because we still need your work and help in being able to get these implemented. It is not goodbye, it is really just on to the next phase. And I think many of us recognize when we got involved in this that the report, while it's a natural coda to the work that we do, it is not the end. That the work when it comes to public health never really ends because the challenges continue. We've seen that over the last couple years. And so, again, just want to commend you for all of your work and express our appreciation on behalf of the General Assembly. We know how hard this commission's worked and know that we will continue to champion the findings and the recommendations of this report as hard as you have worked towards pulling this and compiling this all together. So thank you so much. And thank you to the co-chairs as well. This has been, we're glad we had 3 co-chairs here because, we don't usually form commissions with 3 co-chairs. But, knowing all of the work that went into this, this has been a good partnership with Tosin and Mina and Boris to be able to pull all of this together. You've been, really fearless leaders in being able, and shameless, which is good because we need, folks that are willing to make those asks and pull all of us together continuously. So thank you so much, and also to staff, to Shane and so many others who have helped staff this over the last 2 years of this commission's work. We stand on the shoulders of all the work that you've done, so thank you so much.
Great, thank you to our dear legislators and specifically for your role on this group, right? There was the slot from the House of Delegates, the slot from the Senate. We were blessed with having you both ultimately fulfilling those slots, and by your activism certainly made us stronger. We also take to heart your plea, which is we have work ahead of us. You have work ahead of you as making decisions for the state. We are also given work to be able to support those decisions. Now, I want to turn to the commissioners themselves, which is I just put into my countdown clock that June 30th, 2026, if that is in fact the date, is now 277 days, 7 hours, 54 minutes, and 51 seconds from now.
Oh, my God.
What is it that you want to do in these 277 hours, 7 hours, 54, and now 42 seconds? So I just wasted 10 seconds, right, of stuff that we could have really been doing something progressive about. But anyhow, what does a commissioner want to do? Is there any commissioner bold enough to say this is what I commit to doing as an individual? Okay, if you want to do it now, if you want to do it later at the social, either way. Or what should we be taking into consideration? This is now a message to the co-chairs. What do you want us to be doing to keeping this commission together? Open mic time, folks. Press the button. I want to see some red lights out there. I am shameless, am I? Right. Yeah.
No, but you need, chairs need to be.
I'll jump out there.
Okay.
I don't.
Jean, and you've been great always stepping up. I just got to say that your activism here has really shined through. Jean has never soured away from saying something.
So I don't know what the money cost, so let me say that. But and I don't know what's next for our, for our staff. But I do think that there is real strength in writing papers and just having that out there, especially when you're trying to move policy forward. So again, I say I don't know what the cost would be, but I would be willing to look at that and see if I could pull some dollars out of, I'm a big business, but we're small, big mind, but, it's only 120 full-time staff, so. But I would be interested in speaking to, I don't know if it's Shane or whomever, I'm not sure what that process would be, but paying for a paper that we could put out there. So I don't know, I put the challenge out to the rest of my colleagues that if we could all maybe sponsor a paper a month, that could go. I mean, if we just start slamming, they're like, wait a minute, hold on. I thought these people went away. No, we didn't. So that's something, again, I don't know how much it would cost, but if it's somewhere reasonable, I think that would be something that we could do. I don't have the time to write it, but I'm happy to pay someone who does. And even if it's, I don't know, if it's a fellow that you have at the School of Public Health, we could do that. I don't know how to.
Great.
Give me
We
the
can-
staff,
yeah.
I can figure out the rest. And we could certainly create, we could identify a topic that's in our report that further.
Yeah.
Thank you so much. And the HBCUs will be very glad to be included in the process.
Yes, okay, well, I'm HBCU proud, so, I don't have, right now, I'm running so much. If y'all know how many miles I've covered in the last 2 weeks, but I want it, and if you could give me the staff person that could do it, I'd like to have that done on behalf.
Great, thank you, Jean. Others, ideas, concepts, anything else that from the commissioner's perspective that we should be focused on in the next 277 days, 7 hours, 51 minutes, and 20 seconds?
Being an on-again, off-again, maybe on-again commissioner, I am going to commit to helping to advocate on behalf of this report. It's too important to let sit on a shelf. And I think one of the things that, just to sort of in part build on what Jean was talking about, I think we need two things to help drive it into the realm of three dimensions. And that's a marketing plan and how we're actually going to get it out there. And also, it might be a good exercise for us to look at all of our recommendations and to sort of line them up of what needs to come first before the next thing can come and the next thing can come. Because there are ones that have to happen at the beginning. Are there short-term ones we can short-term wins we can get quickly? And then are there longer-term strategies that we have to line up so that if we have this one first, then we can build into the next one is this, and then the next one is this. And I think it might be worth it to sort of do that as an exercise and then use that in part as part of the marketing plan. And I'm committed to helping with that.
Great, thank you, Matt. Yes, Chris.
I think I would just echo Dr. Levy that there's sort of a mechanism for prioritization. It's extremely difficult. I'm sure it'll be very fraught in discussion, but I don't know where better to have that conversation than in a commission full of myself excluded experts in public health, right? So, I think, the delivery system where I have a bit more exposure has a lot of going on right now in Maryland, and it's there's a lot of change, and those systems are getting redesigned. And I think there's actually potentially opportunity if we are on the ball with respect to the return on investment for public health activities. And, I think that's an area where we aren't right now, so we're short. Now, I think we're fine, relative to peers across the country, sure, but, if we're comparing ourselves to, how you would spend delivery dollars, I think we're not compelling enough yet.
Great, thank you, Chris. Others, microphones are still open. Yes, Michelle.
Thanks. So I'm not really sure where to start. I feel like Delegate Bagnall, when you talked about op-eds and community testimony, committee testimony, I thought, like, how great. And then Jean talked about papers, and Dr. Levy about prioritization, and then we heard from Chris as to the delivery system and all that's happening in the state of Maryland. And then to my right, I have my champion from as the director of the Disparities Center or department over at the State Health Department, and just thinking about equity in this space, and communities and organizations, and certainly individuals that we should be lifting up relative to what's happening with federal funding and with Medicaid. And then I'm thinking about Ruth Mariana and the work that we're doing at Hopkins, and thinking about partnerships and the need for community, clinical, and academic partnerships, and how can we move forward collectively in this space. And so, having highlighted all that has already been shared, I think I'm sitting here thinking about how do we use the individuals in our academic institutions to help move this work forward? Thinking about the individuals who are practitioners in this work and who are interested in public health, and how can we leverage those individuals in our academic centers, in the academic settings, to move the work forward. We know that Maryland is at the forefront of moving so much forward, not just with the AHEAD model, not just with some of what we're doing in the care delivery system, but we have NIH and we have many other governmental agencies at our doorsteps. And how can we capitalize on what's currently in front of us, and how do we use those as resources? What I'm thinking about, I don't know that there's something specific that I'm willing to commit to outside of thinking about who are those tangible partners that we have, the resources that are behind us, around us, that can be supporting the work that we're doing. And so, yes, we have this document. How do we move it into a space that's tangible? What are the things that we can then pull out? I know that there's a number of individuals that I work with at Hopkins who are students who would be saying, I'm doing community partnerships and I want to be involved in this. I'm thinking about local health departments. I mean, Nina, you're sitting to my left. And how do we pull the local health departments to say what are happening within your particular communities that speaks to what we have noted in this document? And what is the priority within St. Mary's County that we should be considering? And if you tell me what that priority is, how do we galvanize and how do we build hubs within? And maybe I am being too aggressive in thinking about that, but this is the way place-based initiatives happen. And so if we have a document that outlines, as you say, is a roadmap for the work that we're going to be doing, how about every health officer being charged with identifying what are those issues within your specific community that we can then identify as the priority and we build on. And that we can then, perhaps it's the op-eds that we're writing towards, perhaps there's a subset of students at your university, Boris, at Hopkins, that we can then say, we're pulling together. There's a whole host of what I can continually think about in terms of what we can operationalize if we're thinking about implementation in a very specific way, using the data. This week I was asked to work on a project with Suburban Hospital, and one of the things they said was, well, Michelle, we have to make sure that we're not looking at individuals, at residents who are in the state of Maryland, but rather Sibley Hospital, who are in Washington, D.C. And I thought, if you're thinking about public health and population health, you may have a subset of those individuals who are crossing borders. And so if we're doing it, if they're looking to do it in DC, how can we capitalize on what we have and the richness of what we have here in the state of Maryland? That was a lot, and hopefully not too convoluted.
Great.
And the Office of Minority Health and Health Disparities, let me be clear here.
Okay.
Thank you.
Great, thank you, Michelle. Any others?
Yes.
Yes, Tosin.
Just, want to echo what my colleagues have said. I think these are all great ideas in terms of, moving the needle for operationalizing this very important work. I would just add to that, I think we can also leverage the support of our public health organizations, both statewide and nationally, especially with respect to advocacy. We really want a lot of these recommendations to, turn into bills, right? So I think, for example, Maryland Public Health Association, they have a great advocacy committee team that can help to, move that forward. Additionally, as mentioned, academic institutions just continuing to, carry them along, internships. I'm sure there are different, students that would love to help in that regard. And, as you are aware, as co-chairs, we're here. And I'm sure our commissioners, we've heard, we have your support. So as we map out what the next step will be, I have no doubt that we have the support of everyone as this continues to evolve. Thank you.
Yes, Jean?
One other idea, if you're in need of space to meet, I've got an 11,000 square foot office. It's in Lanham. Welcome to come.
Great, thank you, Jean. Appreciate that. Okay, as we begin sort of the closing, any other closing statements from individuals or what we can commit to or what is necessary for our commission to do in the next 277 days, 7 hours, 42 minutes, and 10 seconds?
I wonder how many seconds it takes to say that, actually. But thank you, Boris, for keeping us on task. I just, again, echo the comments that have been made already. I don't want to repeat them, but I do want to reiterate the incredible amount of passion and effort that went into this report is also going to be translating to how we implement this report. And I do want to acknowledge that the local health officers who have been a big part of this process and dedicating a lot of time and resources to this process, as well as many other partners that we've had involved, are very interested in providing support during the implementation phase to continue to be a resource as recommendations are considered, either policy recommendations or other types of actions as we move forward with implementation of this report beyond the life of this commission. And I know MACHO, the Maryland Association of County Health Officers, is very keen on being involved in the implementation of recommendations moving forward. I do want to add a note of caution that we did state in the report, but I feel like without dousing the room with cold water, we really need to recognize that so much of this, the motive for this report and the recommendations of these report came from the acknowledgement that our governmental public health system is severely underfunded, severely understaffed relative to what the need is for Marylanders. And in recognition of that, it doesn't do the system good to be overloaded without the funding to support the staffing needed to implement the recommendations or implement the change. So we really need to be cautious and cognizant of as Jean referred to them before, of unfunded mandates, of requirements or actions that are not adequately staffed to be carried forward successfully. There's plenty of will and there's plenty of passion, but we definitely need the bodies as well and the funding to carry out a lot of this work.
Great, thank you. Nicole?
Yes, thank you. So much has already been said. I guess the only thing I would add as a member of the Communications and Public Engagement Work Group and just my passion for public engagement is that I think there are big things that can be done to continue to share this message to make sure that those for whom this is going to be, directly impacting are kept abreast. But then there's also little things. So this is just suggestions for my fellow commissioners. I don't know, I guess a couple years ago, put this role in my LinkedIn profile, which is a very easy thing to do. And as a result of that, I've gotten a lot of questions from colleagues and other professionals in our space about what we're doing and how things are going. And that has generated some really interesting conversations, as well as, just in our respective communities, in our religious communities, in our neighborhood communities, and just continuing to talk about the work. The other thing I would say in terms of leveraging LinkedIn and other social media platforms is it would be helpful, and I don't know who would do this, but if we were to receive like talking points as this work goes forward, just something really concise that we can choose to publish on our own LinkedIn and other social media platforms, I think that could go a long way to just continue to galvanize the excitement around this work.
Great, thank you.
Could we create a LinkedIn group? Why can't we create a LinkedIn commission group?
Mm-hmm.
Okay, oh, sorry. We already have one. Am I not?
I'm not sure of the distinction, but we do have a LinkedIn page for the Commission on Public Health. Part of the challenge, of course, is when we, with our staffing ending, what level of communications can we maintain through the life of the commission? And then certainly when the commission ends, those communication vehicles will end as well.
Great. Anyone else? People feel like they've spoken and done. Yes, Dushanka?
I'm not a commissioner, but I wanted to take this opportunity to really thank the work group co-chairs. Some of you are here, but the tremendous work of, working with your members, making them stay involved, having them be enthusiastic, sharing their lived experiences. And I think that through the eyes and ears and the mouths of 100 and plus members in those work groups, the network is already there. And I think the talking points to share with them, in addition with the commissioners, would further amplify the messaging. But I think if we could keep that conversation going and continue to hear from members as time goes by, and convene the co-chairs for a virtual discussion, I think we'd learn a lot in terms of implementation, advocacy, and strategy. So thank you to all of you.
Great, thank you, Dushanka. I do want to call on a person who's been through this at least twice now, and maybe the only other person who's done that. Perhaps there's others, I'm not sure. But Shane, you also have something to add to this group, having been through this in Indiana once, and now you've been through this with Maryland once. I still remember the day where the co-chairs made a visit to Indianapolis as the Indiana group was celebrating their Public Health Week, I think. It was Public Health Day, and the whole state assembly, the building itself, the Capitol building, was filled with local public health leaders, public health organizations, and it filled the whole corridor of the Capitol. And we who were there as delegates from our commission, this was early on, the first few months of this commission, were just blown away because there was public health and there was this level of enthusiasm. And that was also the day that we first met Shane. And Shane was probably not even understanding that we were interviewing him for a position at that point. We were just talking with somebody who was there. And then we sort of, all sat down and said, we got to try to figure out, because this guy's been through this before and survived and is still smiling, right? So Shane, please add your reflections on behalf of both yourself and the CDC Foundation perspective on this.
Sure, and I'll speak on my behalf since I've not cleared this with the CDC Foundation. Megan's giving me the thumbs up. So this is Citizen Shane here. I've shared some of this with the co-chairs and some of my colleagues, but how this came about in Maryland versus Indiana, and even the process that we took from the very start was very different. And we've borrowed aspects of Indiana's approach where it made sense to, but we've also made sure that ultimately the strategy was tailored to Maryland and the context here. And as someone who, for the better part of the last 18 months, has flown in monthly to see you folks, Thanks for the Southwest status, by the way. I have to say, I'm really proud of what we've accomplished here because Indiana was in a much different place. I mean, you know, the joke that we used to say, and this is public, so I'm not speaking out of turn, but you know, in some public health measures, it was thank God for Mississippi, and so we really had a place of anywhere is better than where we are, and that was easier to sell to the folks in Indiana. With Maryland, you folks had a lot to be proud of already. And I think Josh kind of hit on this in, I think it was March or April of last year when he spoke to you folks, that, you know, Maryland's done well for itself thus far, and now this is the opportunity to really look at how do we keep doing better? What is that process for us to not just be content with where we are, but actually look at how do we really lift all the ships through a rising tide. And that's really where, through a lot of our conversations, the listening sessions that we held publicly, I really have covered all four corners of the state at this point, that we really came to solidify around this idea of we've got to pick up everyone that has not been brought along with us, and focusing in on these health disparities is what's going to get us to a place of you know, even better outcomes, and looking at how do we bring to bear all the great work that MDH is doing, and acknowledging that the local health departments also have a significant role to play in that as well, that this teeter-totter of shared governance is you know, really difficult to define all the contours of, but in so many ways, that's kind of the beauty of it, that it allows a bit of flexibility and I think opportunity for local health officers and MDH to look at how do we work together. And so if there's a bit of hope and optimism that I have about this, I think it's that this report really identifies those key aspects of what we've heard and some great tools to bring that forward. So I'm very proud of what we did in Indiana. It was fantastic work, it was needed work, but candidly that was catch up for us. You folks are now taking a lap around, and I think that's something to also be proud of for you as well.
Great. Megan, is there anything you want to add from the CDC Foundation's perspective? Great. Thank you. And again, please send along regards to Judy, Monroe, and the whole team there who has been very supportive from the beginning with this. Okay. Last aspect for the good of the whole, as we say. Okay, so my concluding statement will be brief. It's been a pleasure and honor to serve in this position. When you've heard me say this before, when the tasking came, when that letter came from the governor's office, there was an initial anticipation, perhaps a shock, and then a full understanding in those first few weeks of complete and utter despair, because the idea here is who is this Tosin, who is this Mina? I don't really know them. And how the hell are we ever going to accomplish this when it comes with no budget, right? And what I've seen in these last 2+ years is the best in people, right? We've seen benevolence, we've seen funders, we've seen activists, we've seen volunteers, we've seen students, we've seen just the best of our society coming together, again, for that goal, right? To create a better life for Marylanders. As we approach 229 days, whatever I said, 7 hours, 28, I'm always captivated at the end of these sessions, right? At the end of a chapter like this, I go back to some of my roots. I am a Ukrainian American. I am a Ukrainian Scout, actually. It's not a Boy Scout since we're a all members organization. And in scouting, one can choose to be a scout the rest of their lives. Yes, imagine me in a scout uniform. I still own it. I still belong to a scouting fraternity that, as we transition through scouting, learning about knots and learning about nature and going with backpacks across the world, but also having a dedication to our national spirit, Ukraine, now Ukraine at war. That was the way we were raised, even before Ukraine existed as a nation. And now you continue with the service component. And as my fraternity that gathers, it's called the Order of the Crusaders, wow, you know, and we gather once every 2 years in a big gathering, and we plan the next 2 years. What are we gonna do for the good of the little kids here, right, who are going to scout camp? What are we doing for fundraising for Ukrainian entities? Are we buying drones this year, is what it's become, things like that. And so we spend a day or two in deliberations. This membership of my fraternity is both young guys, right, it's a post-college thing, and old guys like me. We gather in the room in our uniforms, we make deliberations, we vote on things, we have Robert's Rules of Orders and the code, you know, there's decision-making. But the way we finish is the way I've always been captivated with. And the way we finish after these types of deliberations are with these simple words in Ukrainian. Закінчилися діла, закінчилися слова, починаються діла. And that's the way I want to end this session, which is we're done with the words. Now let's begin the actions. And that's how we close. I ask for a motion to close this session. Sine die. Is there a motion to close? Yes, Chris, that's a motion? Okay, do we have a second? Okay, Michelle seconds. Do we have any discussion about closing the session? Who doesn't want to go to the social? I also at this point want to acknowledge the social tonight is sponsored by Johns Hopkins University. Thank you so much for your benevolence, and the University of Maryland in College Park. Thank you, Boris, for your benevolence. Oh, you're welcome. No, there's no need to thank me. Yes, there is. Oh, you've been so kind. No, there's really no need to. I can go on and on. But that being said, I also want to thank Shane, who with his whole team became event organizers, and the role of Macho as well, in that we couldn't even figure out a way how we're going to pay for the social tonight because, you know, do we write a check? I suggested at our last meeting, let's do it the Washington way, non-sequential, unmarked bills in a paper bag and put in behind a plant, and that's how we handle it. But somehow we're going to have a social tonight. So in conclusion, let's take a vote on closing this session. Everyone for closing, say aye. Aye. Anyone against? Any abstentions? I use the gavel and we close sine die.